So pregnancy and vitamin D relate very importantly, because we've shown in pregnant women who are vitamin D deficient that they have a much higher risk of having preeclampsia, the most serious complication of pregnancy.
What is that?
And so preeclampsia, it causes high blood pressure, and it can actually lead then to what's called eclampsia, which can lead to death. So it's a very, very serious complication of pregnancy. And pregnant women who are vitamin D sufficient have a 400% reduced risk of being preeclamptic during pregnancy. We also showed that vitamin D, of course, is very important for muscle function, which is important for the birthing action. And so we did a study in our hospital over 200 women and showed marked reduction in needing a cesarean section just by being vitamin D sufficient during pregnancy. Also, other studies have shown that premature births are markedly reduced for pregnant women who are vitamin D sufficient. So it's very important for women, as soon as they become pregnant, but even before that they should be having adequate vitamin D intake. And my recommendation, based on the Endocrine Society practice guidelines, is to take between 1,500 to 2,000 units a day on top of your prenatal vitamin. It's perfectly fine and safe. And also, it's been demonstrated that infants born of women who are vitamin D sufficient, they have a marked reduced risk of acquiring wheezing disorders. And so all of these are very relevant for pregnant women to be thinking about the health of their infant and child. We also know that during childhood, vitamin D is very important. Why? Some studies have shown, for example, in Finland, that Finnish infants getting 2,000 units of vitamin D a day and followed for 31 years reduced their risk of acquiring type 1 diabetes by 88%. Also, we know that if you live above Atlanta, Georgia, for the first 10 years of your life and are more prone to vitamin D deficiency, you have a 100% increased risk of developing multiple sclerosis, not only for the first 10 years, but for the rest of your life. It's imprinted. So we know for children that they need vitamin D, and there are multiple studies, including the ones I just discussed, that vitamin D sufficiency during childhood reduces risk of autoimmune disorders later in life. For adults, there's good information to suggest that it can reduce risk for many deadly cancers, including breast cancer and colorectal cancer. It reduces risk for neurocognitive dysfunction disorders like Alzheimer's disease and depression, reduces risk of heart disease and type 2 diabetes, and reduces risk of infectious diseases like COVID.